130 billion euros. That's the estimated global profits from illegal drugs made by organised crime groups each year. Given such figures, are we losing the war on drugs? Like any industry, profit comes down to supply and demand. One country that may offer answers is Portugal. 12 years ago, it embarked on a controversial new strategy to tackle its drug problem. Paul Hackett reports.
In 2001, Portugal was in the throes of a massive drugs epidemic. Crack cocaine and heroin were easily found and in common use. In response, the government shocked the world by taking the decision to decriminalise the personal use and possession of all illegal drugs. In Lisbon today, one consequence of that change is street teams now dispense methadone to heroin users.
What would you do if this was not here?
I
don't even want to think about it. It would be very difficult for me because I'm taking huge quantities. If they weren't here, it would be very hard for me.
For me, it was very important. I've had serious problems with drugs for about 30 years, and they showed me the light at the end of the tunnel.
I'm feeling really well. I've stopped thinking about taking drugs. It's really done me a lot of good and helped me a lot. I feel like a new person.
Drug trafficking still remains a serious crime in Portugal. Drugs have not been legalised, but those caught with a small amount for personal use are sent before a dissuasion commission instead of a court of law. The issue is regarded as a health rather than a criminal problem.
It's still illegal to use drugs in Portugal. If you're caught in the possession of any illegal substance, it will still be apprehended from you. The difference is that you don't get a criminal record and you don't get a jail sentence eventually.
When the law was introduced, opponents predicted a huge rise in drug use, but overall, consumption today appears stable and may have actually dropped. Drug-related infections such as HIV have also declined.
More than 10 years on, what does Portugal's radical approach to drugs tell us? Perhaps the biggest lesson that can be drawn, according to experts, is that decriminalisation doesn't inevitably lead to a massive increase in drug use.
The figures that are coming in do not show that there is any particular disadvantage to the system, do not show that it is any way worse than the system that was around previously, and therefore the Portuguese see no reason to change it.
By contrast, Portugal has moved in the last month to clamp down on the country's so-called smart shops, which get round the law by selling legal highs. Critics of decriminalisation say the government's latest crackdown proves Portugal's politicians have realised the current system has failed.
It's a fact that nowadays the deputies in Portugal are doing a rethink of the actual drug policy that allows each and every citizen to handle drugs until 10 days in the pocket. If the Portugal system after decriminalization, if it was so good, why Portugal is changing? Is because the policy is fantastic? Is because the results are gorgeous? Of course not.
Well, there is no perfect systems, I have to admit that. To the critics, I would say that the best thing is to compare to what was happening before. And in Portugal, what was happening before was that there was already a de facto decriminalized model working because people were not going to jail because they were just using drugs.
Joining me now is Antonio Maria Costa, former chief of the United Nations Office for Drugs and Crime, and Howard Marks, once described by one British tabloid newspaper as the most sophisticated drug baron of all time. Gentlemen, many thanks for joining us. Portugal is pretty much unique in Europe. Why?
No. Portugal is not unique, has never been unique, and probably will not be unique. Portugal happens to be the flavor of the month. Everybody's talking about Portugal. In my view, the situation has basically not changed. So there has been a positive development of assisting drug addicts in hospitals rather than putting them in prison. But I would say this is not new. It has been going on now in Europe since many years.
What's your take, Mr. Marks?
Oh, well, I'm a little confused now as to the so-called inaccuracies that you've pointed out here, and I don't know which are right. But it seems to be generally an improvement there. was the general message of the news report. Are you saying there hasn't been an improvement there, but a deterioration? And do you think other people should follow suit? Other countries should follow suit?
Certainly, I agree with you. Certainly, other countries should follow suit in recognizing that drug addiction is an illness, psychological, physical, cultural, and of other varieties.
What about drug use? What about totally recreational drug use? Is that a deviant
recreational
behavior?
drug use, well, I'm speaking on the basis of what our governments have decided. Our governments have decided, starting about 100 years ago, and with the Convention of the United Nations 50 years ago, that drugs are dangerous, and as a dangerous, therefore they should be kept under control, and they are controlling them.
Are they dangerous, Mr. Marks? Do you consider drugs dangerous?
I don't think they're necessarily dangerous. I think that's quite conceivable to have a non-deviant use of recreational drugs.
Is it sensible to advocate the use of drugs? I think this is what Mr. Costa is saying.
If 9 times as many people are non-problematic about their drug use, I think it's worthwhile to consider their happiness and what they want from life. So just because a very, very small percentage of people have drug problems, yes, of course, address those problems and cure them as best you can and treat them as best you can. But I'm standing for the right to be able to take recreational drugs as long as there's no problem.
Legally?
Yes.
All drugs?
Yes, all drugs so far discovered.
The availability of drugs through some form of legalization, making basically buying drugs the same as buying alcohol or buying tobacco, we risk creating a pandemic as we have for tobacco.
So you're
that
saying
humanity will regret for centuries, the way we are
prevention
regretting
measures
them.
are working?
Say it again?
Prevention measures on drugs are working?
How would you explain otherwise that the consumption of drugs has been contained to a fraction of the population? Because people just don't want to risk the sentencing, the penalties, and the coming from the violation of the law.
What's your response to that, Mr. Marks?
Well, it's, I mean, I think, yes, to a certain extent. I mean, as China sort of got rid of sort of all heroin use by killing people who took heroin, I mean, you can sort of do it by means which, you know, are sort of unacceptable to most democratic countries. Yes, you can reduce it. If there are no drugs around, then of course there's not going to be any dangers from drugs. But there's also not going to be any of the advantages of drugs, and these could include medicinal advantages as well as recreational ones.
The real problem is that our countries, despite your own personal experiences, our countries are not fighting drug trafficking. For example, in terms of marijuana trafficking, there is basically no law enforcement, very little, because to some extent it's considered a drug with less harmful consequences, and because in many cases, like in the Netherlands, like in Portugal, like in other countries, people don't go to jail because of it, thanks God.
You don't think they should go to jail? So you think...
I have always said that, that drug users should go to hospital, not to prison.
But even for marijuana?
For anything. They are sick people, so they need to be treated.
People who smoke marijuana recreationally are sick?
Well, you know, once you lift the stone, you find a nest of snakes, and everybody's attitude towards drugs, towards alcohol, and towards this problem.
Okay. And so in terms of cannabis, Mr. Marks, we're seeing now on the market particularly potent forms of cannabis, skunk, which there has been a link between that and psychosis, particularly amongst adolescents. Surely there's a case there for limiting its use.
There is a correlation, you know, I accept, between people who take cannabis and people who have vague schizophrenic problems.
Vague schizophrenic problems is...
Yes, as opposed to definite ones. Your first point that it's stronger, yes, but I mean doesn't require rocket science just to use less. You know, I mean, I can't say.
You're kind of very influential amongst young people.
No.
Do you not? You go and speak at universities. People hold you up as a role model, a kind of a rebellious role model. Do you not worry that your attitude could be causing harm?
Well, I'm trying to be a role model to geriatrics. The fact that young people sort of view it differently. I mean, I don't promote the use of drugs at all. It makes no difference to me whether people use drugs or not. What I do oppose, vehemently is the punishing of people who decide to use drugs for whatever reason.
In a nutshell, what would you see as the way ahead?
Legalization, where you've got sort of like conflicting ideologies like this. I think they can only peacefully exist in a situation such as we see is happening in Portugal now. I see this as an example of sort of, all right, going somewhere in the middle of those two things, thereby enabling greater sort of, knowledge and understanding of what might be the problems with any drug.
Mr. Costa.
Well, my closing words will be very simple. I applaud any efforts by member states and international organizations to recognize that drug addiction is an illness which has to be treated. I said that many times today, in hospital, not put in prison. And I ask also greater efforts and more serious efforts in clamping down on drug trafficking, on traffickers and related interests, which could be insurgency, could be secret services and whatever, and against banks that speculate, profiting from the profiteers, the traffickers, and from, of course, those who consume drugs, which are really the least fortunate people in our societies.
Gentlemen, many thanks. Two very different points of view, but still some common ground, which is quite surprising.
A lot of common ground.
So it's estimated nearly 1 in 4 Europeans have tried cannabis at some point in their lives. That's more than 80 million people. So decriminalise or legalise. What do you think? Our debate continues on social media. In the meantime, thanks for joining us.